Hello, everybody. Welcome to Module 2 of Maternal, Infant, and Young Child Adolescent Nutrition e-learning course. This module focuses on maternal nutrition, and this session we will discuss about preconception nutrition. Preconception care is the provision of biomedical, behavioral, and social health interventions to women and couples before conception occurs. It aims at improving their health status and reducing behaviors and environmental factors that contribute to poor maternal and child health outcomes. As we know, life course perspective should be adopted to address maternal and child malnutrition. Extending this continuum of care one step before pregnancy can improve the pregnancy and child health and nutrition outcomes. Let us understand about nutrition care during preconception period. As you know, preconception care is critical period spanning the weeks around conception when gametes mature and fertilization occurs till the developing embryo forms. This period is the most sensitive period of life when health behaviors can produce long lasting impact. Preconception interventions are targeted to women of childbearing age in the period before and between consecutive pregnancies. So, why preconception care is important? The focusing on preconception care is important because it presents a period of special opportunity for intervention as critical development processes like embryogenesis during very early stages of pregnancy is influenced by mother's nutritional status and nutrient stores. Also, availability of adequate amount of nutrients just before conception and during early pregnancy also influences the critical process of fetal development. Maternal underweight during preconception period was found to be associated with preterm birth and small for gestational age babies. Overweight and obesity during this period increases risk of preeclampsia, GDM, and cesarean section. Also, the positive effect of preconception care includes the reduction in maternal and child mortality, prevention of unintended pregnancy, and reducing adverse birth events like stillbirth, preterm birth, and low birth weight babies, prevention of birth defects and neonatal infections, reduction in underweight and stunting, and also lowering the risk of type 2 diabetes and cardiovascular disorders in adult life. So, what are the risk factors during preconception period that need to be focused? So, first important risk factor is maternal age. It is found that teenage pregnancies increases the 50% risk of stillbirths and preterm births, while advanced maternal age is associated with increased risk of perinatal death and preterm birth. Also, advanced maternal age increases the risk of Down syndrome. The micronutrient deficiencies like iron deficiency anemia and folate deficiency are associated with increased risk of fetal growth retardation and neural tube defects. Underweight increases the risk of preterm birth by 32%, while underweight in mothers increases the risk of preeclampsia and GDM. The nutritional goal for women in preconception period should be attaining optimal weight. So, underweight women need to increase their weight, while overweight and obese women should work to reduce their weight and reach to optimal weight. Also, diagnosis and treatment of anemia is most important to achieve nutrition goals. Correction of other micronutrient deficiency, including folate, is very important to prevent birth defect and neural tube defects. Optimal physical activity helps in improving the pregnancy outcomes, and also correct lifestyles, including stopping alcohol and tobacco consumption, are important. So, what are the nutrition interventions that need to be focused during preconception period? So, supplementation of 400 micrograms folic acid daily is important. Along with it, monitoring of nutritional status, taking balanced diet, information, education, and counseling is also very important to achieve nutrition targets. Along with it, screening and management of diabetes and other existing medical conditions, promoting exercise and consumption of iodized salt are some of the important interventions during preconception period. So, assessment of nutritional status is most important during preconception period, and including underweightness and obesity, screening for anemia, adequacy and quality of diet consumed are very important recommendations. For underweight and anemia, counseling for balanced and diverse diet, consumption of iron and folic acid rich food, nutrient dense food supplementation, vitamin and mineral supplementation, and IFA supplementation as per guidelines for anemic women should be followed. So, key messages for this session are: poor nutritional status of mothers before and during pregnancy extends throughout life course, lead to intergenerational vicious cycle of undernutrition. The preconception nutrition interventions targeted to women of childbearing age in period before and between co- consecutive pregnancies is important. Availability of adequate amount of nutrients just before conception and during pregnancy may influence critical process of fetal development. And most important is nutrition intervention need to be combined with sexual and reproductive health services, including family planning, as well as women's empowerment as a part of holistic preconception care service. Thank you for your attention.